sir.
Thank you, Dr. Ronaksha and
Thank you.
Sahani sir.
Thank you.
Good evening, good afternoon, and good morning. This is the 1672nd day of a continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Shalini. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. We have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. We have the international session from 8:30 to 9:30 and from 9:30 to 10:30 a local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who miss the session can watch it again. You can share it with your friends and you can share it with the homeopathic lovers so that we can take homeopathy to every home around the world. That's the purpose of this forum. And let me come to today's guest. As you all know, today our guest is Dr. K.A.SHALINI. She has completed the BHMS and graduation from Government Homeopathic Medical College, Bangalore in 2009. And she has completed certificate course in children health, that is CGH, and certificate course in gynecology and obstetrics, that is CGO, and certificate course in skin and venereal diseases, SVD, from BIMT Pune, Maharashtra. And she is a physician at Homeopathic Charitable Center, Bangalore, from 2009 to 2015, and physician at Nisarga Army Clinic, Bangalore, Karnataka, from 2015 onwards. And today, Doctor will be discussing about tuberculosis and its homeopathic medicines. As you all know, last week we have celebrated the World Tuberculosis Day, and let us let us see what Dr. Shalini has to say about this tuberculosis and homeopathy. We proudly welcome you, Doctor. You can begin the session now.
So thank you so much. First of all, wish you all a very happy Yugadi. Today I have got opportunity to speak about the tuberculosis and homeopathic treatment for it. As Sir told, we have already celebrated March 24th, the World Tuberculosis Day. So I have taken this topic so that we'll just refresh the knowledge what we know about homeopathy. The tuberculosis and its homeopathic approach. So I'll be sharing the screen. Okay. So World Tuberculosis, that is TB Day, it is celebrated every year on the date of 24th March. So we have many remedies for the tuberculosis. As we all know, tuberculosis, it is a lung infection or the like tuberculosis, it affects the lungs first. So we'll know the definition of tuberculosis, that is TB. It is a serious infectious disease caused by the bacterium Mycobacterium tuberculosis. It primarily affects the lungs, but it can spread to other parts of the body, such as kidney, spine, and brain also. So many antibiotic treatments are there in the allopathy, but it will treat only the symptomatic. But we have wonderful remedies in homeopathy where it treats the person as a whole or the individuality. It treats the individual person. So there are many complementary approaches also. We can see in the diagram or the image. See, in the active tuberculosis infection, person may experience chronic cough with blood containing mucus. So any person who has cough more than 2 weeks, that is more than 14 days, we can suspect that he may be having tuberculosis. So the cough which is more than 14 days or the 2 weeks. So in the image, you can see the infected lungs. So the Mycobacterium tuberculosis, that is the bacteria which causes the tuberculosis. Is it visible? One second. One second. Yeah. See, you can see in the picture. So the Mycobacterium tuberculosis, it affects the lungs and it can spread to many other organs of the body like the kidneys or the brain or the spine. So we'll see what are the symptoms of tuberculosis. So how we'll know that it may be or it may be a suspective? The symptoms of active TB, there will be a prolonged cough that is more than 2 weeks. This is a key symptom, often lasting 3 weeks or more. It may produce sputum, that is the phlegm, and it may contain blood and mucus. So there will be chest pain. So the pain in the chest area. So there will be weakness or fatigue also. So feeling unusually tired all the day, and there will be sudden weight loss, that is unexplained weight loss. So there will be loss of appetite and there will be evening rise of fever and chills. So you can see the picture, like for easy we can memorize the tuberculosis symptoms. So there will be fever, so there will be tiredness or the fatigue, and there will be unexplained weight loss, and there will be prolonged persistent cough more than 2 weeks, and there will be blood in the cough, and there will be night sweating will be there. So these are the characteristic symptoms of a tuberculosis patient. So in our clinical day-to-day practice, when any person comes to us saying that he has cough more than 2 weeks or more than 3 weeks, we have to suspect that it may be due to tuberculosis, and we need to send him for the blood investigation of Montax test. So when it comes negative or positive, then the further treatment has to be done to that person. So the types of tuberculosis, we'll come to know what are the types of tuberculosis. So the tuberculosis can be classified into two types based on the location of the infection. That is, first one is the pulmonary tuberculosis and the second one is the extrapulmonary tuberculosis. So based on the sequences of events, tuberculosis is of three types. That is the primary tuberculosis, and the second one is the progressive primary tuberculosis, and the third one is the post-primary tuberculosis. Also, these are the types of tuberculosis. Yeah, see. So, as I have already told, it is of two types. There is the first one is the pulmonary tuberculosis, and the second one is the extrapulmonary tuberculosis. And based on the sequence, the first one is the types of tuberculosis is primary tuberculosis, progressive tuberculosis, and post tuberculosis. So how will diagnose whether it is tuberculosis? As I told, more than 2 weeks, if there is prolonged persistent cough, then we need to send it for sputum test. That is the Montax test. See, you can see the sputum smear microscopy test is done. Interferon gamma release assays test and chest X-ray. This is the commonest. Chest X-ray we can find out, and Montax tuberculin skin test is done, and geno uh, gen expert test is done, and nucleic acid amplification test is done. So generally for tuberculosis, we send it first for Montax test, that is the skin test, and the chest X-ray and the sputum examination, sputum test. So what are the complications if a person is diagnosed as a tuberculosis patient, and what it may complicate to him is, the first one is the hemoptysis can be it can be a complications to pulmonary tuberculosis, and there may be pleurisy, that is the liquid accumulation in the pleura, and there can be a pleural effusion can be a complication, and empyema can be a complication, and pneumothorax, this is the commonest, pneumothorax, aspergilloma, endobronchitis, bronchoectasis means the inflammation of the bronchioles with the blood accumulation, and laryngitis, and there may be cor pulmonale, and there can be CA bronchus. So CA bronchus means it can spread to other organs also. The cancerous can spread to other organs also. Enteritis, miliary tuberculosis, and HIV related opportunistic infection. The most what is the danger of the tuberculosis is, it can turn into HIV related, means the immunity of the body is reduced so that other infection affects the person. So, what are the ways to prevent tuberculosis? As it spreads from one person to other person, so we need to ask him to wear the mask. The general, he needs to, if the person is diagnosed as a tuberculosis patient, we advise him to wear mask, so that while coughing it can spread to other person also. No, so we ask him to wear mask, and he has to wash his hands frequently, and if he is coughing he has to wear mask. So get a BCG vaccination, the preventive measures, get a BCG vaccination, eat nutritious food, and avoid exposure to people with active TB. Means any healthy person, he has to uh, avoid the person who has been active TB patient, and maintain good personal hygienic is very important, like we have to wash our hands frequently, and if we are coughing we need to close our nose and cough, and we should not spit everywhere, and if other person are doing, we need to advise them to not to do like spitting or spitting everywhere. That is the commonest thing we see. And visit a doctor for diagnosis or for early diagnosis and treatment. So the main preventive measure is personal hygiene. We need to wash our hands frequently, eat nutrition and food, and we have to while preparing food. Before preparing food, we need to wash our hands, and whatever fruits and vegetables we buy, we need to wash it properly, boil it properly, and have it. So these are the commonest preventive measures of tuberculosis. Means we need to avoid the person who has tuberculosis. If the person is diagnosed as a tuberculosis patient, he needs to wear mask. Okay. The homeopathic remedies for tuberculosis, as we commonly like in homeopathy, first major homeopathy remedy is tuberculin. So frequently employed to mitigate recurrent respiratory issues and fortify lung infection. That is the most commonest homeopathic remedy, tuberculin. And the second one is the calcarea carp. Addresses fatigue, cough, and night sweat, symptoms commonly observed in tuberculosis. Silicea assist in enhancing immunity and managing chronic pulmonary conditions. Phosphorus beneficial for persistent cough and chest pain. I'll discuss about the calcarea carp patient, which I have seen in my practice. Actually, one lady, she is a calcarea carp patient. She is fair, and she's fat, and she has irregular menstrual cycle was there. And the individual characteristic individual characteristic symptom of that patient was, she was craving for chalk piece. She has craving for chalk piece. So she used choppies and raw rice. She used to keep in her bag wherever she goes, so that there was craving for choppies and raw rice. And she had persistent cough, and on Montag's test and chest X-ray, she was diagnosed as a tuberculosis patient, and she was on allopathic treatment. And like when she came to me, like I spoke to her, I identified her, and the characteristic symptom which I got was choppies, craving for choppies and raw rice. And based on that, I gave the remedy Kerkeria car, and it worked as a magic. That craving came down in her, and that persistent cough and fatigue also slowly it came down in 2 to 3 months. So that was my experience with Kerkeria carb tuberculosis patient. Hmm. Other homeopathic remedies for tuberculosis. So homeopathy offers a range of remedies that can support individuals with tuberculosis, addressing various symptoms and strengthening the body's natural qualified homeopathy practitioner. So any person who is reading this or in Google, he should not self-diagnose and self taking remedies harmful. He has to approach a homeopathic practitioner and he has to take the medicine. The first and foremost is the remedies tuberculum. That is the tuberculum, best for chronic tuberculosis with recurrent infections. Symptoms is the predisposition to cold, respiratory infections or bronchitis, persistent weakness, recurrent cough with fever. Mechanism of action is aims to booster the immune system, enhancing the body's resistance to frequent infections and respiratory elements. So this is the first and foremost tuberculum remedy. So the second one is the Calcarea carb, best for individuals with general weakness and recurring infections. Symptoms include chronic cough, dyspnea, that is difficult breathing, general physical debility, night sweats, and weight loss. Mechanism of action is addresses fatigue, night sweats, and weight loss, improving vitality and, and enhancing the body's resistance to infection. The third and foremost important remedy is the phosphorus, best for tuberculosis with hemoptysis, coughing up of blood. Symptoms include hemoptysis, chest pain, shortness of breath, weakness, anxiety, and fear of death. Mechanism of action is helps elevating bleeding from the lungs, reduces coughing, and provides relief from chest tightness and breathlessness. I would like to discuss one case of tuberculosis with phosphorus patient. Many years back, I got one patient. He was a phosphorus patient. He was lean and thin. He was lean and thin. He was fair. He fitted into phosphorus patient. Uh, like he had this chest pain, shortness of breath, and frequent cold and cough was there. And he had cough more than 2 months actually. He went to other like Ayurvedic treatment, allopathic treatment, and all. And last he came to me. Like on I the characteristic symptom which I saw in him was the anxiety. He was very intelligent, but he had that weakness was there and anxiety was there. He used to sit alone, and based on that, I took the case and I did the repertorization. So phosphorus came, and I advised him to take phosphorus 200. within 2 months, that anxiety, that weakness and all, it came down. So this is my experience with phosphorus remedy. And the other remedies are the silicea, that is the best for advanced stages of tuberculosis with abscesses or pulmonary cavities. Symptoms include chronic respiratory infections, persistent cough, and purulent expectoration and profound weakness. And the mechanism of action is supports the body's elimination of toxins, promoting pulmonary healing and reducing purulent material buildup. Bryonia alba, it is best for dry, painful coughs and pleuritic chest pain. Symptoms include dry, hard cough worsened by movement, and there is pleuritic chest pain, especially on the right side, excessive thirst, irritability, cough aggravated by talking or deep breathing. Mechanism of action: reduce pulmonary and elevates discomfort associated with dry and painful cough. So Bryonia alba also is a very good remedy. Like in my practice, I got a patient of Bryonia alba, and he had the dry and painful cough, coughing all the day, and it worsened on the movement. So based on this symptom, like worsen aggravation on movement, Bryonia alba was prescribed, and it helped him. So in homeopathic, we need to find out the individual characteristic symptom. We need to find out when any patient comes to us, we need to take the case properly, and the mind mental symptoms and the characteristic symptoms we need to ask, or we need to identify. Then only these medicines will work. Other important remedies are the Drosera rotundifolia, best for persistent cough, particularly nocturnal cough, that is the nighttime the cough is aggravated. Symptoms are violent spasmodic coughing, fits often leading to vomiting or choking, hoarseness, dyspnea is seen. And the mechanism of action is it diminishes coughing spells and improves breathing, especially during nighttime exacerbations. So Drosera, the characteristic is the nocturnal cough and persistent cough is seen. The next important remedy, common remedy, arsenic album. It is best for weakness and respiratory distress. Symptoms is dyspnea, cough, general exhaustion, anxiety, nocturnal restlessness, cold sweats, and fear of death. So arsenic album has a characteristic symptom of fear of death. He is feared of death. Mechanism of action is relieves severe weakness and breathlessness, restoring energy and reducing respiratory discomfort. When we see in our day-to-day practice, we get many patients, and these characteristic symptoms will be there in one or the other person. In arsenic album, fear of death, I have got this. I have got this patient, this symptom patient who had fear of death. So we need to take the, and then when we see the repertorization, when we see the symptomatic individual remedy, fear of death means arsenic album has helped for me. Then the next commonest remedy, homeopathic remedy, is the Hepar sulphureus calcareum, best for suppurative cough and infection. Symptoms of chronic cough with thick yellow. So any patient who comes to us saying that thick yellow, we can think of Hepar sulph. Chronic cough with thick yellow-green sputum, tendency to form abscesses, sensitivity to cold, susceptibility to infection. Mechanism of action facilitates mucus breakdown, 1 second. Facilitates mucus breakdown, reduces cough, and prevents further infection. I will share my experience with Hepar sulf. There was a patient, Hepar sulf. He had he was around 22-year-old boy. He took all kind of antibiotics. He went to higher doctors and he spent so many money also. But he had this persistent cough more than 2.5 months. More than 2.5 months. And he had this persistent cough, and there was thick yellow sputum. And he had abscess on the body. So based on that abscess and thick yellow, I prescribed Hepar sulf, and that abscess and that cough, that yellow phlegm, or everything came down with Hepar sulf. So Hepar sulf is very good remedy. After Hepar sulf, Silicea can be thought of. So these are very good remedies which help the patient. Yeah. And on March 24th, 2025, we celebrated World Tuberculosis Day in one of the government school and in one of the primary healthcare center. So all the students, staff, around 100 members participated, and the ASHA workers also participated. So we gave the importance of the tuberculosis, the signs and symptoms, the definition, and what are the complications and how we can prevent it, what are the symptoms. We did awareness at the school and the primary health care centers, and we also did a skit by demonstrating how the cough will be there more than 2 weeks, and how they need to go to a primary healthcare center and take the Montax test. And for ASHA workers also, at their levels, at the village, at the ward level, they need to know, like any patient with more than 2 weeks, they have to bring to primary healthcare center and help them to get the treatment. So we need we did a awareness education program and free health camp also on 24th March 2024. 2025. Uh, so, uh, so thank you so much. So thank you so much. So this was the tuberculosis and its homeopathic approach, or its homeopathic treatment.
Thank you, Dr. Shalini, for an excellent session. And we really covered all part of this tuberculosis and its management with homeopathic remedy. You have mentioned about some of the remedies that really works for tuberculosis from your experience. That works for the treatment of tuberculosis. There are some persons having some questions in the chat box. Somebody is asking about the potency. You can mention about that and then why that potency was given. Okay.
So in my practice, I usually prescribe 200 potency. 200 potency for 3 days, PD or TID for 3 days. And after that 15 days, they need to come follow is done. And in follow, SL or PL is given. So the observation is done. I usually prescribe 200.
Yes, that is the potency because since it is it being affected on the lobes, that is.
And in some cases, one more. So, based on this, we are
Dr. Raman saying that is starting with the tuberculum like that. Whether you start the treatment with the tuberculum. Yes. Since your network is weak, we cannot hear what you're telling.
yeah, like uh,
There's
now we
lung opus medicine. And Kumar Yadav Theory. Can everybody hear it? I can't hear it. Can anybody
so patient comes,
please make
yeah, patient comes, you need to take
hello? Hello, everybody can hear it or not? Please. As we all know that tuberculosis is a condition nowadays. Hello, doctors. Can you, if anybody want to talk to Dr. Shalini, you may raise your hand so that we will allow you to unmute yourself. Yes, there is some problem in hearing what you are saying. Yeah, there is some problem with your network, I think. Yes,
one second.
yes, Dr. Tariq. Please, Tariq, I shall that. Tariq Suber, Dr. Tariq Suber, you please unmute. Please, okay. Once again, you may please unmute. You are muted. Okay.
Sir, thank you, sir. Thank you. Thank you, sir. Can I ask the ma'am that allopathic science, I am not in favor. That's another question. Has eradicated tuberculosis. Should we also homeopaths who can suggest such medicines which also can beforehand eradicate what to talk of treatment that is afterwards preventive remedies. Can madam suggest or not, ma'am? Sir, thank you. Sir, have you?
Speaking, frankly speaking, the government. Yes, Dr. Shalini, we cannot hear you. Let me please hear. Please. Nowadays, the government of India has restricted us from practicing undertaking treatment for tuberculosis. In as far as in the state of Kerala, it is not allowed because whenever if you check a patient for tuberculosis and if you find that the person is having tuberculosis, then we are asked to direct the patient to the special centers where tuberculosis is being treated. That is policy put forward by the government of India, and particularly that is implemented by the government of Kerala. Very recently, I have a patient who was under my treatment, and all of a sudden, I asked him to check the blood test, X-ray, and everything. It was found that the patient was diagnosed as a tubercular patient, and all of a sudden, what happened was then it was reported from the center itself to the officials that it is a case of tuberculosis, and as a result, the health inspector and health people, authorities from the other system of medicine, reached his home and took him to the hospital where the treatment is being given. So they were asked them to stop all homeopathic medicine, the person was forced to take this medicine, even though he was not willing to take allopathic medicine, because he is a person who is a strict believer of homeopathy. But unfortunately, the rules of the day is not allowing us for that. In the early part, we used to treat a lot of tubercular patients, and we were able to cure them successfully without any problem. So there is a rule that is restricting us from doing that kind of undertaking that kind of treatment. Is it there in Bangalore and other part of the India, or what is the situation there? Dr. Shalini, do you have you ever? You may please unmute. You are muted. You are muted. Yes. Please unmute. Yes. We can't hear you. Is there any problem with your network?
Sir, I'm not able to. Yeah. Yes, sir. Yes,
Yes.
sir. What you said just now is the correct. Sir,
We still
is
be,
it audible now?
your network is not so poor that we cannot hear you properly.
So what you said is correct.
Yes.
Yeah.
Yes. Yes.
For any tuberculosis, sir, is it audible? So is it audible?
Yeah, it is still missing. It is audible, but it is missing. The link. We cannot hear the
Sir,
sentence.
is it audible now?
It is vibrating. You may do one thing. You may leave and you may rejoin, so that sometimes it may. Otherwise, you may close the video and then talk.
Is it audible? Is correct? Like when any person who has been diagnosed as a tuberculosis patient at the primary. Okay. Yeah. Okay. Any person who has been diagnosed at primary healthcare center, the treatment is given with tablet. This treatment is given for at free of cost at the primary healthcare centers. So now is it audible now?
Yes. Now it
Now
is
it's
audible. Now it is
yeah.
audible.
Yeah. At the primary healthcare center, the treatment is started by the medical officer for the tuberculosis patient. That is the correct approach, sir. Yeah, as as it can spread from one person to another.
Yes,
So the treatment is given at the primary healthcare center. Yeah.
Yes, this is what I would like to add to this session, because that's a thing, that's a rule now. This is going to happen to each and every disease now in the future.
Yeah.
That is what the medical bill is all about, published by in Kerala. And as a home, as the Homeopathic Association, we people went
Mm.
there and we have given memorandums to the people who were producing. Who were brought to this bill into the assembly, and they have changed a little bit of that so that we can practice anything now. But whenever there is a restriction, we cannot do that. That's what is happening. As far as tuberculosis, there is a specific rule, and this
Yeah.
is the methodology the government has undertaken now.
Hmm.
Is any Dr. Tariq, you can speak now. I have. Please unmute yourself, Tariq. If you want, Tariq Subair, please unmute yourself and you can speak. If you want to speak, you are not recording, so that means I'm inviting Dr. MG Geeta to say a few words on that. In the early part of our profession, we used to get a lot of tuberculosis patients as well as patients with this primary complex. But nowadays things are different. Whenever something is some person is diagnosed as a tuberculosis patient or a primary complex patient, they may be forced to, they may, in the present setup, there is a rule and law which uh, is in favor of the other system. And even though we have remedies, we have treated and cured a lot of patients with the primary complex, particularly children of below the age of 10. But nowadays, whenever we diagnose such a case, they even used to say that it's not that case, but like that, this is happening around this present scenario. Dr. Shalini,
Yes, sir.
can you hear? Okay.
Yeah, yes.
Then, have you used arsenic iodide for the treatment of this like problems or
Huh. Sir, I have used HEPA sulf and arsenic album for the prolonged cough, not for the person with diagnosed with tuberculosis. Prolonged cough more than 2 weeks. I have used HEPA sulf and arsenic album based on the individual characteristic symptoms, and it has helped.
yes? Actually, we can, what is your experience in treating this asthma in children?
Yes, sir. Sir, in children, for asthma, sir, asthma, as we all know, the characteristic symptom is the wheezing. The wheezing will be there. It can be heard. So on auscultation also we can know, and for the children also we can make out the noise. That is the wheezing is the characteristic symptom, and cold and cough fever will be there. And in this kind of asthmatic patient, in small children especially, arsenic album will help, as there will be restlessness, anxiety, that symptoms will be there. Arsenic album will help in children.
Okay. Very recently, just some 3 days back, I have a child from one of my relative who called me a doctor and told me, hey, the child is having this much of asthma and everything is going on. Then I asked what is the condition, whether she take anything, only a little bit of saliva, she is coughing and then vomiting like that. Then I asked her to check the tongue of the patient, and it was clean and there was salivation. So, and even she don't like to take the water also. So I just prescribed a dose of Epica 30. On that night, she slept all the way, and by morning everything was fine. And last night she went for a festival, and today and took a lot of meat, chicken, and ice cream like that. And in the morning, they called me and told me that, doctor, there is nothing there is no asthma, but still she's vomiting. The thing is that since the asthma is over within 24 hours, they gave everything, and they took the child to the festival also. That's kind of speed the homeopathic medicine have. If the if the signs and symptoms of the case is matching with the simillimum, definitely it will work in the short time. Otherwise, actually, this child, they used to take this child to hospital every time, and they admit there for 2 to 3 days and come back, and they give a lot of antibiotic. The fever was recurring every now and then. And suddenly one day I told them that it is better to stop. They have not the confidence of stopping allopathic medicine. They used to say that, oh, we are giving medicine for this allergy. The child is having allergy. They have tasted so many tests, and this child is only just 3.5 years old. And they have diagnosed that it's a kind of allergy that is happening, why this child is having recurrent cough and fever. Actually, it was a case of asthma. I just told them that it's a case of asthma, so there is nothing like allergy. You can give anything and everything, but it doesn't matter. But you need to keep the child healthy by protecting the child from giving all these analgesic as well as antibiotic as well as antipyretic every now and then. That is the biggest cause for asthma, I must say. But whenever there is a fever, when you suppress the fever, definitely the cough will come out, and the cough will gradually, when the cough started, they may give some kind of suppressants that may, or some kind of cough syrup or something like that. Then actually it will turn into a big problem. Then they may settle with pneumonia, and once they may note that it's a kind of pneumonia, then they ask the patient to admit in some hospital for the treatment, and then after giving medicine there, then they allow the patient to go back home within 3 to 5 days. And after reaching home, they used to take the child, give them oily bath and everything, and all of a sudden, then fever may come up again. Within 2 weeks, again the child may having the same problem. So this kind of repetition, in those cases, actually what I do is that I just give when a patient come of that category to my clinic, I just give them a dose of tuberculum in the first 2 3 days, and then wait how it come up, and naturally everything will be subsided within 2 to 5 days. And when the patient have a cough and cold for the second time, then we will get the clear picture of the child, whether the child is a phosphorus, whether the child is a pulsarilla or something like that. Then we can give the medicine accordingly, and that will work. This is what I have seen in many patients. So now the child is okay within for 24 hours. That's what I would like to add to this session. And now I invited Dr. Sridhar sir to say a few words on management of tuberculosis, sir.
Sir, whether it is audible?
Yes, sir. Everything fine, sir.
Okay. That, see, the first case I treated, that those days there was a called primary complex. That is telling it is the beginning of the TB. So I started in the year 1975 last, I started my practice. That time, one of my neighbors, two child, they are very poor. So he started crying and sitting and crying and crying. Then I asked, what is the happened for you? Then he told me, my two children in the one medical college, they told it is primary complex. I gave the injections and tablets, but there is no relief. Now I have no money. I just passed only. I was not having any that much experience, but I took the case very detailed. The symptoms are this thing. The both children are lean and thin, but usually we may think that some other anyway both are lean and thin. One is the 9 years, another is 6 years old, 3 years difference, and the sweating of the head and palms and legs was there, and the main symptom I observed was the craving for the eggs. They like eggs. Now you got the most of the people might come and got the remedy. Anyway, that I took very details. I am not remembering because immediately I joined this just now. I was in another class. That is why I just came out. So I was not able to know what it is. Anyway, I prescribed calcare carb. Those days also I was using 0/3. Then I prescribed few doses of calcare carb continuously few days. Then it is completely, then they went and checked. The primary complex was disappeared. That is my first case. Then another case. Whether is time is there.
You must speak now, sir. There are
And another case, I treated a case of real tuberculosis. The patient came, myself and my assistant was there. We are not able to take his case complete. We sent him as much as early. The according to our homeopathy, each our these things, 5 senses. Hanuman mentioned that the use the 5 senses with use that how you can take the case. That time you must have to use your 5 senses. That then you will get the medicine. Anyway, this time my sense worked in the nose. That that the main is eye, then one is eye, one is nose, one is taste. That the another is that the kinesthetic. That these are the sum up to the 5 senses that you can. That is means 5 the senses that you must have to use when the patients may come. By experience, it will come. I wasn't able to sit. I couldn't take the case. Then immediately it came into mind. When the rats may decade these things, very decayed types of the smell it came, that it leads into arsenic. That I prescribed few doses of arsenic with tuberculinum vannam in intercurrent remedy. It is within 1 or 2 months. His tuberculosis was completely cured. So sometimes we must have to observe with our perceive with our 5 senses. Hanuman mentioned the first few paragraphs, he mentioned about it. We must utilize our 5 senses always. That sometimes the smell, sometimes the color, sometimes the temperature, that the upper part may be different, the hands or legs, and like that. So many things you must have to observe with your senses. Then you will come to a conclusion. Sometimes immediately you can take it as a rare, uncommon, peculiar symptom that you can decide, and you can, in such type of the cases and such type of the symptoms are very, very important. Anyway, after that, I got confidence with a few up to the, not so many, but about 10 or 15 cases of tuberculosis, I was able to cure completely. Nowadays, it is very less number, but those days it was very, very common tuberculosis. But I got the confidence that with tuberculosis also we can easily cure with our homeopathic constitutional medicine. Definitely, it is possible. Then another case, I was cured with arsenic iodatum. One lady came for me, spitting with the blood, and treated. Her father was a homeopathy doctor. Due to that faith, he came and she came and she went to several doctors, but they were not able to cure. But I gave her arsenic adatum and one dose of tuberculum mannam, and it is completely cured. Within not so many years, it was about 15-20 years duration, chronic cases, but it was within 2 or 3 months, it is completely cured. So our medicine can be cured with any type of the disease if you may take the case very details and totality and reach into the constitutional medicine. Definitely we are able to cure such type of the cases. Thank you very much for giving me an opportunity. Thank you very much. I was not knowing who is taking the class and all.
Yes, sir. Thank you very much, sir. It's really a very good answer to my question, and you really presented 3 cases in a short time. That's it. It's up to Dr. Shalini. You can say something on that, on sir's comment.
Sir, a very good knowledge which you shared with us. Whatever you said, like starting like some 1976, you treated one patient with the homeopathic remedy. That experience was like it will help us in our day-to-day practice. So as we all know that for tuberculosis, the best medicine like at the government level is at the primary healthcare center. But any cough prolonged for more than 2 weeks, not the patient of tuberculosis, any cough, generalized cough, homeopathic medicine will help in treating based on the individual and characteristic symptoms. When we take the case based on that, homeopathy will definitely cure the prolonged cough cases.
Okay, thank you very much, Dr. Shalini. Now I invite Dr. Mariamma John to say vote of thanks to the session.